And June is Acne Awareness Month. Experts say breakouts can happen at any age, and dermatologists are actually seeing more patients during the pandemic.
Yeah, and Dr. Evette Ramsay, she's the Chief Dermatologist at Kaiser Permanente Baldwin Park. She joins us this morning. First off, good morning, Doctor. Thanks for joining us.
Good morning.
Yeah, so we want to talk about adult acne and how to clear up the condition, talking a little bit about how it can occur at any stage. So what are the causes of this skin condition that we're seeing?
So the primary cause of acne is clogging of the pores, and clogging of the pores occurs primarily by two mechanisms. First, we have oversecretion of oil glands. The sebaceous glands produce more oils than they usually do in our teens. And then there is clogging of the pores by dead skin cells. So these two factors are the primary factors that teenagers get acne. But acne can actually occur at any age, even in newborns. So there's a form of acne called neonatal acne that occurs in about 20% of newborns. And we see acne well into adulthood too.
And are you seeing more patients with breakouts in the pandemic because of mask wearing, stress, things like that?
Absolutely. We know the benefits of masks. Masks definitely help prevent the spread of COVID, but we're also seeing a definite increase in acne with mask wearing. Masks can cause friction with the skin. They can contribute to increased humidity and an excellent environment for bacteria and yeast to form on the skin under the mask. So we are seeing an increase in acne with masks.
Yeah, let's talk a little bit about diet. Does diet impact your acne? Are there certain foods that we need to stay away from?
Well, the jury's out because we don't know exactly what causes it, but we know that a Western diet can definitely contribute to acne. By Western diet, I mean a diet with foods that are high glycemic, meaning they raise the blood sugar. So things like white bread, rice, high carbohydrate diets, sugary drinks, these things can contribute to flare-ups of acne. Another interesting thing is actually low-fat milk can cause a flare-up in acne in teenagers. So diet definitely can contribute. The exact cause we're not sure of, though.
And we're just about to enter summertime. And does being out in the sun or maybe going to tanning beds, does that make acne worse?
Definitely. It can contribute to increasing the dryness of the skin. And when the skin is dry, the oil glands try to compensate by producing more oils. So even though exposure to UV radiation like sunlight or tanning beds can temporarily mask the effects of acne by maybe camouflaging the skin or making the acne scars less noticeable, in the long run, it will actually cause a flare of the acne.
Yeah, and Dr. Ramsay, last question real fast. For people who are watching, what are the best ways to combat acne?
So it depends on the severity of the acne. There are simple over-the-counter treatments like benzoyl peroxide that can help with the acne flares in mild cases, but some people actually need oral antibiotics and prescription creams. So it really depends on the severity of the acne and the degree of involvement.
Okay, so, and I'm sure you recommend see a dermatologist if you're concerned about the condition.
Absolutely.
All right. Dr. Evette Ramsay, thank you so much for being with us this morning and for sharing this information. Very helpful to a lot of people.
My pleasure.